Bonjour tout le monde. Good morning, everyone. My name is Paul Bennett, and I'm a member of the Board of Directors here at the Ottawa branch of the National Association of Federal Retirees. First, I would like to begin by recognizing the First Nations on whose traditional lands our branch office is located. This is unceded traditional territory of the Algonquin Anishinaabe people. On behalf of the branch, I am pleased to welcome you to today's session on cardiorespiratory fitness and its effects on health and combating chronic illnesses. I want to welcome our presenter, Dr. Pierre Boulay, from the Faculty of Physical Activity Sciences at the University of Sherbrooke. Dr. Boulay has over 30 years' experience in the primary and secondary prevention of cardiovascular disease as a kinesiologist and manager. He also has expertise in the evaluation of cardiorespiratory fitness with nearly 25,000 maximal exercise tests to his credit since the start of his career. I'd also like to thank Dr. Glenn Kenny, who you might already know from his many webinars with our branch, for helping to organize this webinar with Dr. Boulay. Veuillez noter que cette session sera présentée en anglais, mais la participation bilingue est toujours encouragée. I want to give a special welcome to anybody here who is not yet a member of the association. We hope these webinars will inspire you to join us, and to our members, we trust that these webinars will encourage you to maintain your membership. Finally, if you have any questions, please type them in the Q&A box throughout the session. Dr. Boulay will respond to them during the question and answer period at the end of the presentation. That's all from me right now, so I'm going to turn the presentation over to Dr. Boulay. Thank you.
Good morning, everyone. Happy to see that there's a lot of people participating this morning to this webinar. So cardiorespiratory fitness. So I'll try to make the case this morning, or try to convince you how it is important. So, and also I want to make sure that I don't bore you with so many studies. So I'll present you the major studies that are showing the impact of cardiorespiratory fitness. So often what you'll hear cardiorespiratory fitness, often people will refer to it as aerobic capacity, or sometimes you may hear the word VO2 max. So it's the same thing. So cardiorespiratory fitness refers to the ability of the circulatory and the respiratory system to supply oxygen to your skeletal muscle during sustained physical activity. So the better your cardiorespiratory fitness, the more you can do endurance exercise, etc., and sustain that activity for a long period of time. Before we talk more about the cardiorespiratory fitness, and the majority of you, from what I understand, you are retired. So many people, when they talk about life after retirement, or even myself, I'll probably retire within the next 9 to 10 years. And I was asking my wife yesterday, so what's your goal when you retire? What do you want to be able to do, etc.? And what's your 4 major goals? And it's probably the same as what the majority of you have. Is the first thing she said was to be healthy and physically fit, to be able to live long, to be independent, and also to be financially secure. So a lot of it, like healthy, living long, being physically fit, is really important, and that will have a significant impact on the quality of life after you retire. So over the year, if we just look at life expectancy at retirement, so the last data that came out in 2020 from the Public Health Agency of Canada have shown that people on average at 65 years of age, or what we say usually is the age of retirement, so you can expect to live an additional 21 years. Luckily for a female, actually this life expectancy is a little bit longer. So it's about 22.3 years versus 19.5 in men. However, a woman will spend a greater proportion of their life post 65 years of age in an unhealthy state. So they live longer, but not necessarily healthy. Okay? So we've seen over the years what's been happening. I'm not sure if you're seeing my cursor, but the life expectancy at the age of 65 has been increasing. So in 2000 was about 18.8 years. Now it's at 21 years. but the health adjusted life expectancy also has been increasing. But the gap between the two also seems to be increasing. So there's about 6 years. And that's self-reported when we talk about the health-adjusted life expectancy. If we actually look at years with disability or chronic disease, it's even more than that. Okay, that's what we can see. So the thing is, life expectancy is increasing, but also we want to make sure that we stay healthy as long as possible within this increase. So if we look at years lived with disability, so the leading causes are, and most of you know that already, it's diabetes, hypertension, stroke, heart failure, chronic obstructive pulmonary disease. So it's kind of the same chronic diseases that we've seen over the years. But in the last few years, what's been increasing sharply is Alzheimer, dementia, and cardiovascular disease is still increasing over time. Okay. So what we want to do is when we retire, we want to make sure that we have less of those complications, or if we have some of those chronic disease, what can we do to have a better management of those disease or actually decrease our risk of mortality? So in 2017, the 5 leading causes of death due to chronic disease were cancer, ischemic heart disease, dementia, chronic obstructive pulmonary disease, stroke, and we have seen since 2000 an age standardized mortality rates that actually declined, but we had mortality rates due to dementia that increased about 59%, while mortality rates due to Parkinson's disease and hypertension increasing by 26 and 12% respectively. Okay, so those are all things that we'll see later. Exercise can have an impact on these chronic diseases to improve the management, but also to decrease the risk of mortality. And at the age of 65 years old and over, those are the more prevalent chronic diseases that we can see in Canadian adults. And you're probably familiar with the majority of those chronic disease. And often we hear people say, or patients, it seems that every time I go to my family doctor, I have another health issue or I'm prescribed another medication, etc. And we want to try to find ways to avoid having kind of just an increasing in different medication use, etc., and just making sure that we are healthy. And the landscape for chronic disease will vary a little bit from women to men, but they're about the same chronic diseases. So the prevalence is just a little bit different. For example, osteoporosis is a little bit more prevalent in female than we will have in male, but the majority of chronic diseases that I mentioned earlier are present in both women and men. So one thing that's good about chronic disease management is that the majority will share the major, some common risk factors. So hypertension that we hear often, hyperlipidemia, elevated cholesterol, overweight and obesity, prediabetes are all common risk factors. And we do have non-modifiable risk factors. For example, as we age, we can't change that. We know with some chronic disease, some sexes is more prevalent. And some ethnicity, there's some chronic disease that are more prevalent. But the behavioral risk factors, this is something that you as an individual can play an important role. And the two major is nutrition, but the other is exercise, which will have an impact not just on the risk factors, but also on the management of those chronic disease. One thing that's important about exercise, you just need one type of exercise program or what you like to do and what interests you. If you have diabetes, you have specific medication for diabetes. If you have hypertension, you have specific medication for hypertension, etc. For exercise, you just need to have a structured exercise program that will have an impact on all of those different chronic diseases, which is really important. Okay. And exercise, as we are going to go in the next few slides, I'll talk more about exercise and stay away from those the chronic diseases. As you see, exercise is really important, not just doing exercise, but you also want to improve your cardiorespiratory fitness, because this is what will have more impact on your quality of life and also decreasing your risk of mortality. So for the management of chronic disease, as I mentioned earlier, if we look at what's really important, and yes, you do have like either you have hypertension, diabetes, cardiovascular disease, cancer, etc. You always have those three important parts of a management of a chronic disease. There's exercise, there's nutrition, and there's pharmacological treatment. Okay. For every chronic disease, you'll need different medication, but for nutrition and exercise, it's kind of the same and to have an impact on all of those variables. So I'll talk more about exercise. It doesn't mean that pharmacological treatment is not important. Nutrition is also important. It's just exercise is one of those three major components in a good management of any chronic disease. I do want, before I talk a little bit more about cardiorespiratory fitness, make sure that I talk a little bit about physical inactivity or sedentary behavior, because this is also really important. Okay, and one good meta-analysis that was published a few years ago in the prestigious journal of The Lancet, they've looked at over 1 million individuals that followed them for a few years, and they looked at the impact of sedentary behavior, meaning like sitting for several hours in a day, and the impact that it actually had on mortality risk. And what they came with the conclusion is sitting for more than 8 hours per day with no additional physical activity, meaning doing no exercise. Whoops. So it's similar to smoking and obesity in terms of mortality risk. So if in a day you sit more than 8 hours, this is the same risk as smoking or having a problem with obesity. If we want to counteract the effect or eliminate the effect of this sedentary behavior, that we don't have a choice, like people work, we're not always standing, we're not always walking, so we do sit in the day, we do travel, etc. So to eliminate the negative effect of sitting for 8 hours, the conclusion of that study is that you need to do at least 60 to 75 minutes of moderate intensity physical activity. So this is huge. This is significant. Okay. So that's why eventually at the end, we'll talk more about what to do, what you can do to improve your cardiorespiratory fitness. But a lot of it is also making sure that you're not making sure that you don't have a sedentary lifestyle and that you do take kind of exercise snacks, break, etc. during the day, that you'll move a little bit, even if it's not part of a structured exercise program. So talking about cardiorespiratory fitness. So in 2016, so that's already about like 7-8 years ago, there was an important paper that was published in the Circulation Journal, so by the American Heart Association. So it was a scientific statement talking about the importance of assessing cardiorespiratory fitness in a clinical practice, meaning that every doctor, cardiologist, etc., should be testing cardiorespiratory fitness with their patient. Easier said than done. Not everybody's equipped to do that, and it's not a viable practice. There's already waiting lists. It's complicated to do this type of testing, but they were making a case for fitness as a clinical vital sign, meaning that cardiorespiratory fitness is as important as measuring your blood pressure, as measuring your cholesterol level, as measuring your blood glucose level. So they were putting emphasis to the medical field that we should be able to measure cardiorespiratory fitness on each of our patients. And even if that was published in 2016, they were actually looking at data from several studies and even dating back into 1989 that they've shown clearly. Those are studies that were done at the Cooper Clinic, and there's a lot of scientific citation about this paper in many research that are being published on a regular basis. Is they showed clearly, we have in black, the black bars here, those are the men, and in white are the women, that's showing that those who had the lowest cardiorespiratory fitness had the highest risk of mortality compared to those with moderate fitness level and high fitness level. Okay, and high fitness level, we're not talking about athletes. It's just when we're looking at the general population, you divide them in tertile in three groups, three equal groups. Those who were in the lowest fitness level had a higher mortality rate. So we've known that for many years. There's a few studies that came out after that showing exactly the same results. But since this paper was published in 2016, there's a lot of new research that came out emphasizing the importance of cardiorespiratory fitness. I'm just going to highlight a few that which I feel that are more, and they had better graphs to make the case about cardiorespiratory fitness. So the first one that was published in 2018, so 2 years after, and you'll see there's many papers that were published 2-3 years after. So they were actually looking at the same thing. So they looked at 4,000 individual, over 4,000 individuals that were followed over 24 years. So they had data, they went and looked back at the data. So those are individuals that were tested, had a cardiorespiratory fitness test, and they still had the data and to look if they were still alive, etc. And so they followed on average for about 24 years, and they show exactly the same results, that individual in both male and female. So you have in red, you have the woman, in blue, the man. You actually have this exactly the same trend. If you had a low fitness level, your mortality risk was increased, and as your fitness level was increasing, your mortality risk was decreasing. In 2018, in the Journal of American College of Cardiology, the group of Kokinas actually looked at the change in cardiorespiratory fitness on survival. So the first part, what they were doing, so they actually looked at not just healthy individual. So the previous study was done on healthy individual. This study, they looked at data of over 93,000 individual. Some have different chronic diseases, as we'll see later. But here they compare those who had cardiovascular disease, so on your left-hand side, and those who had no cardiovascular disease. And they did the same thing. They looked at the cardiorespiratory fitness. And here in this graph, they do present the data in MET values, so a metabolic equivalent. So just to give you an understanding, right now, if you're sitting and you're listening to me talking, so your energy expenditure is about 1 MET. That's the amount of oxygen in your body per kilogram body weight that needs to just survive and stay awake and listen to me while I'm talking. Right now I'm standing up, so probably I'm at about 1.1, 1.2 METs. So the individuals who had cardiovascular disease, when they divide them in quartiles, if you look at the first quartiles, those who were less fit, on average, they had a cardiorespiratory of 4.8 METs, meaning that when they were at their maximum capacity, the energy expenditure they needed was about 4.8 or near 5 times greater than what they produce when they are sitting at rest. So when we look at those in the lowest fitness level to those in the second quartile versus the third and the fourth quartile, we see that improvement in cardiorespiratory fitness decreased significantly your risk of mortality. And that's even on the left side if you have already cardiovascular disease, or compared to those on the right side who had no cardiovascular disease. You actually have exactly the same trend. If ever you had a stress test at the hospital in the cardiology clinic, just to give you an example, if ever you did the stress test on the treadmill, if you were able to accomplish the first stage of that test, usually you have about 4.6 to 5 METs. If you were able to complete the first 2 stages, your cardiorespiratory fitness is around 7 METs. If you complete the 3 first stages, you have a functional capacity of about 10 METs. And if you complete the test, you do the 4 stages, then your cardiorespiratory is at about 12 METs. So to give you an idea, if ever you did a test at the hospital on the treadmill. So it's interesting to see, like, even with a chronic disease like cardiac disease, having a better fitness decrease significantly your risk of mortality. Also, what they did, they look at the same individual. So we had over 93,000 individuals. So they look, if we look at the upper left side, so those who were the least fit in the first quartile, and they looked over time, they were followed for more than 8 years on average. And those who actually were the least fit, but they improved their cardiorespiratory fitness by 0.1 to 2 METs or greater than 2 METs. And I'll explain to you how much exercise you need to do to improve by 2 METs. Their risk of mortality decreased significantly. So even if right now you're not fit, you have a low cardiorespiratory fitness, if you do improve that fitness level, you will decrease your risk of mortality. And on the other side, if you were the least fit and your fitness level on follow-up decreased, your mortality risk increased. And that's for every baseline cardiorespiratory fitness. So even if you were in the high fit category, even in that category, if you improved your cardiorespiratory fitness, you decrease significantly your risk of mortality. And even if you were in the highest fitness level, if you decrease your cardiorespiratory fitness, you actually increase your risk of mortality. Okay. So it doesn't mean that if you were an athlete when you were younger, that this will protect you for a long time. You do need to maintain that cardiorespiratory fitness. So they did the same exercise and looking at individual with cardiovascular disease. So if you have heart disease, you are in the least fit quartile. If you improve your cardiorespiratory fitness, you decrease your risk of mortality. If you decrease your cardiorespiratory fitness, you increase your risk of mortality. And the same thing for each fitness level. So they've shown that in people with cardiovascular disease, but also in individuals who had no cardiovascular disease, we actually have exactly the same scenario. So that you have heart disease, you don't have heart disease. If you improve your fitness, you decrease your risk of mortality. If you decrease your fitness, you increase your risk of mortality, independent on which fitness cardiorespiratory fitness group you were at baseline. Another study that was also published in 2018, and this is where it becomes interesting anyway, I feel, that is looking at your cardiorespiratory fitness, but they do classify people what is considered low, below average, above average, high, and elite. So they had 122,000 individuals. They followed for over 8 years. And so they had individual from 18 to about, I think was 90, 95 years of age. So they categorized the fitness level for each individual. And what they did, what low fitness here in that study, what it represents is those are the individuals that were at from 0 to the 25th percentile. So if you're below the 25th percentile, below average is if you were between 25 and the 50th percentile, above average 50 to 75 percentile, and high 75 to 95 95th percentile, and the elite was the 95th percentile and over. So in every group, we had somewhere between 27,000 and 30,000 individual, and the elite group, the over 95th percentile, was somewhere around 3,500 individual. So the data here is presented again in MET level, so in metabolic equivalent, but I'll show you also a table at the end on when it's represented in milliliters of oxygen per minute per kilogram of body weight, what usually we do in a research lab. So what's interesting is that they look at those different categories and they look at the survival rate after 10 years. And what's really interesting here is if you're in the low fitness level, meaning below the 25th percentile, your survival rate was significantly reduced. Okay. And just being in the next category below average, so between the 25th and the 50th percentile, your survival rate was decreased, but not by as much as the low fitness level. Okay. This is really where you don't want to be. You want to make sure that you improve your category, and that's what we'll talk about later. How can we improve and go to the next category? So when they look at statistically and they adjust it for different for age and different chronic diseases, etc. So when we look again, when we compare to the lowest fitness level, so hazard ratio of 1, if you go to the next category below average, you actually decrease the risk of mortality by about 50%. And that risk continued to decrease as you go from one category to another. So at the end was something like about only 30% of the risk of mortality compared to those who were in the lowest fitness. And they looked at the data, if you look at figure B, comparing men and women, you have the same trend, so even more lower risk in women, but we have exactly the same trend in men and women. So the better the fitness level, the lower your risk of mortality was. What's interesting in that study, they compared that to smoking, coronary artery disease, diabetes, hypertension, end-stage renal disease, and we have the risk of mortality here. And we have the dots on the side on the graph. If we compared the lowest fitness level to those who were considered elite or really high, I wouldn't say elite, but it's not a professional athlete, but kind of the above 95th percentile, the risk of mortality was greater for those who were in the fitness level comparing the lowest to the highest, as in comparison that somebody that smoked or didn't smoke, or had already coronary artery disease versus not coronary artery disease, or had diabetes versus not. So just the fitness level, and even if you compared the individual who were in the lowest to the one above average, who had a hazard ratio of 2.75, that was still higher than the data for diabetes, hypertension, smoking, etc. Showing again that the importance of cardiorespiratory fitness is really significant and will decrease your risk of mortality. So in that same study, what they did also, they look again with coronary artery disease, like the previous study, cardiovascular disease. The lower your fitness level, the higher your risk of mortality, and it decreased significantly as your fitness level increased. So that you had coronary artery disease, or if you had diabetes, or if you had hypertension, or hyperlipidemia, so meaning high cholesterol level, the more fit you are, the better are your chance of staying alive longer. Your mortality risk is significantly reduced. So usually like in research, or I've been working for years now with Dr. Kenny, and when we do testing in Ottawa in the lab, we do present data in milliliters of oxygen per minute per kilogram. So the amount of oxygen, your aerobic capacity. So um, the same graph, the same table I showed you earlier in METs, those are the values in milliliters of oxygen per kilogram of body weight per minute. So if ever you do have your cardiorespiratory fitness level, pretty sure some of you came in the lab for research in the past. If you do have your data, you can actually know where you are situated. Okay, and what would be considered a good number? Okay, obviously a good number, you want to be at least above average. If you're looking at your decreasing your risk of mortality, you want to make sure that at least you're not in the lowest, that below average, you will significantly decrease your risk. But then going to above, high, and elite, eventually, obviously, it's better, but it depends also on your time investment. And this is a good thing. When you increase your cardiorespiratory fitness, like the first thing I mentioned during the talk, it's your ability of your circulatory and your respiratory system to bring oxygen to your muscle during sustained physical activity. So when you improve your cardiorespiratory fitness, it means that you improve your ability of your lungs, your heart, your circulatory system, your muscle to be more efficient. So obviously this will have a significant impact. So what would be your target? That depends on how much investment you want to do and how by how much you want to improve your cardiorespiratory fitness. So the same group that actually published the article in 2016 just published another article. Actually, it's still not in press. It's available online, only came out 10 days ago. Again, making a case on making cardiorespiratory fitness a clinical vital sign that every individual should know their number and every physician, clinician should try to get to measure the cardiorespiratory fitness of their individual. So not everybody's equipped to have a lab or the equipment to measure directly cardiorespiratory fitness, but there's still ways that you can do tests that will predict your cardiorespiratory fitness. And there's actually some formulas that you can use also to try to, without doing any tests, to try to predict your cardiorespiratory fitness. Some say it's really reliable, but anyway, myself, I prefer doing a real test, probably because I've did so many over my career. But those are numbers that you should try to get an idea. It is as important as knowing your blood pressure value. It is as important of knowing your cholesterol level. So if you do have an opportunity, try to see someone that will help you get those numbers. So in that article that is just came out online that will be published in the next few months in the journal, they highlight again and they talk about all of those studies I've just mentioned, but they also give an idea of how much is needed to improve your cardiorespiratory fitness. Okay. So in figure A at the top here, they say if you want to improve your cardiorespiratory fitness by about 1 metabolic equivalent, so it means about 3.5 milliliters of oxygen per kilogram of body weight per minute, you need to do at least 150 minutes of exercise per week. Depending on where you fall on the table, 1 MET usually will make you go from one category to the another. If you want to improve by 2 MET, that means that you need to do about 300 minutes of physical activity or structured exercise per week. Okay, so it's kind of a big investment. However, I don't completely agree with this. It depends. If you're that individual that just follow the basic guidelines saying, okay, I'm going to do some walking, nothing really structured, probably you'll need about 150 minutes per week to increase by 1 MET. If you have a structured exercise program that was tailor-made for you, with specific exercise intensity and what you should do, etc., how to vary the intensity, probably 150 minutes per week of aerobic exercise, you'll get closer to about 2 minutes increment in your cardiorespiratory fitness. So we do know genetically some are predisposed to improve more following an exercise program compared to others. So there's a lot of inter-individual variety in aerobic capacity improvement with an exercise program. But if it's tailored individually, so you have something personalized made for you, there's less variability in your cardiorespiratory fitness. So when I'm talking about the 150 minutes per week or 300 minutes per week of structured exercise program, I'm talking more about the upper part of the pyramid here. Okay, but still, even if you're doing structured exercise program, it's important to have good foundations. So a lot of you now have tools, you have intelligent watch, etc. You can measure the amount of steps you're doing per day. We want to make sure that minimally we do at least 7,500 steps per day. If you do less than 5,000 steps per day, that is considered sedentary behaviors. Many studies have shown that you increase your risk of diabetes, cardiovascular disease if you do less than 5,000 steps per day. You want to target at least 7,500 steps per day, and yes, 10,000 is better. You want to limit those sedentary behaviors that you're sitting for several hours without doing anything. So you want to integrate exercise snacks like you stand up and move a little bit during the day, kind of interrupt those long periods of times you're sitting and not doing anything. So you want to make sure that every day you're active. Just doing some activity, it doesn't have to be structured exercise, and use active commute or public transit. So don't always use the car when you go to one place to another. So this is still important. Okay, this is really important that you have a good foundation. But the structured exercise program, this is what will help you improve your cardiorespiratory fitness. So we've known for years physical activity and exercise is important, but the cardiorespiratory fitness is also a clinical vital sign that's really important. And to improve this, you need to have structured aerobic exercise program. That's where your 150 minutes of exercise, you want to make sure it's at an adequate exercise intensity. And this is where a kinesiologist or exercise physiologist can help you, and to include resistance training. So it can be a mixture of both, like when we talk about the 150 minutes or 300 minutes per week. And if possible, you want to include higher intensity interval training. So short bursts of exercise that are done at a higher intensity, just to increase a little bit the physiological stress on the body and try to improve more your cardiorespiratory fitness. So some will say that the second part here, the structured aerobic exercise resistance training, usually represent about 80% of your training volume, and about 20% should be done at a higher intensity. So moving forward on healthy aging, what is important, if you can, try to know your number of your cardiorespiratory fitness. Try to know where you are situated within the table. Are you in the low fit category? Are you below average, above average, etc.? You can have access, depending on where you live, try to find a kinesiologist, exercise physiologist that will help you find your number, that will do an exercise fitness test to know your number, or even more, get involved in research. So luckily, depending on where you live, for folks in Ottawa, for example, in the lab, we do a lot of testing, and those are numbers that you can get depending on which type of research you get involved. And I'll get back to this in a few minutes. So you should try to know your cardiorespiratory fitness. Also, if you have a fitness test that is done, then it's easier to find the right dosage for you. The amount of minutes per week you need to do, the intensity, the amount of frequency you need to do. The frequency of exercise would depend on your typical day, how much active you are, etc. So kinesiologists, exercise physiologists will help to determine that. So knowing your fitness level, you can actually, it's easier to get to know the right dosage of exercise you need to do to have an improvement. It's a little bit like when you have hypertension, you see your physician, we'll start a medication, we'll start it at a specific dosage, we'll do a follow-up to see if that's managing well your high blood pressure. If it's not managing well, it will increase the dosage. That's the same thing we do with exercise. So make sure you find an exercise and an activity you enjoy. So this is common sense. No reason for exercise to be a torture. I think some people see it as kind of a torture, etc. You can find exercise programs, something that you'll find pleasure and you'll enjoy doing it. So yes, physical exercise, it's an investment on a healthy retirement, a little bit like when you were investing in rears, etc., for your retirement, to make sure that financially you'll be able to have a good retirement. So exercise is the same thing. It's an investment. It will help to prevent different chronic diseases. And if you have already a chronic disease, it will help with the management and decreasing your risk of mortality, etc. So take action. It's never too late. Like I've shown in the data, even if you're in the lowest cardiorespiratory fitness, studies have shown just after 4 or 5 years, your risk of mortality is significantly decreased. Even if you're in the lowest category, independent of your age, you will decrease your risk of mortality. For folks that are in Ottawa, I'll leave you with that last slide. And I'm still involved. I've been involved with Dr. Kenny, I think, for almost the last 20 years, doing all the cardiorespiratory fitness testing for individuals that are older, that get involved in our research on exposure to eat and exercise, etc. This is something that we have to do for all of our participants. We actually test the cardiorespiratory fitness. We do it with the ECG, etc., because we want to make sure that we don't put anybody at risk during the research protocol. But those are data that we measure in the lab when we do research, that you can have access to it for free. So obviously, if you meet the criteria to participate in a research project, you will have that test done for free. It's part of the research protocol. And I'm pretty sure you can find other research group in your region, depending on where you live, that will actually give you access to this type of data, etc. So I don't know if anyone have any questions, or try to look in the chat. How that works.
Yes, we do have some questions, Dr.
Okay.
Boulay. And I would encourage listeners and viewers to type further questions into the Q&A box. We'll begin with the first one. Is VO2 max testing still available at the lab?
Yeah, in Ottawa, in Dr. Kenny's lab, like we do test many individuals there, and it's part of the research project, etc. Actually, we have participant that comes like every 2 or 3 years that participate in research project, and they do it like to help with the research knowledge, etc. But also they're interested to see how they're doing in that. Did they improve or maintain their fitness? What's important at a certain age? You want to maintain, you want to make sure it doesn't decrease, etc. You wanted to add something, Glenn?
No, that's good. I don't know if you can see me, Paul and Pierre, but I'm somewhere there, I hope. But yeah, absolutely.
Yeah, I see you now.
There's lots of opportunity, as Pierre has indicated. One of the things that we are doing is with the climate heat health adaptation with Health Canada is building our work on us, understand the effects of heat stress. So that includes exercise. So certainly if individuals are interested, as Pierre indicated, and you do want to get that fitness assessment and really get a good understanding of your overall health and well-being, we do the fitness assessment with giving you the report that Pierre indicated as to giving your where you rank in terms of your level of fitness relative to the general population.
Okay, thank you. it's hard to get an assessment of cardiorespiratory fitness, including a stress test or a VO2 test. Are there any third-party pay-for-service options?
There are. So you just need to make sure you will. I know in the Ottawa region there are places that they have kinesiologists, exercise physiologists doing testing that they do have the equipment. You just need to make sure if you have a chronic disease or you have heart disease that they're comfortable doing tests with your chronic condition, etc. It is true that in hospital setting it's hard to get a test. There's wait lists. And it's not that they don't want to do a test, but in the hospital setting, it's a little bit complicated sometimes. You do need to have an issue for having the opportunity to have a test done there. But there are some places where you can have a test done. And it doesn't always have to be with the metabolic cart like we have in the lab. This is gold standard, but also just having a test done without all the equipment, and then they use predictive formula will give you a good indication of where you are compared to the normative data, to the general population, etc.
Okay. Can improving your cardiorespiratory fitness substantially elevate your good HDL cholesterol levels?
Some of the good studies that were done many years ago, they've shown like to have an impact on the good cholesterol, the HDL, intensity seems to play a role. So you need to make sure that your exercise intensity is high enough. If you're just doing low intensity walking, etc., it may have an impact, but not as much as doing a higher intensity exercise. So some studies have shown that people who goes from walking and kind of jogging or cycling at a higher intensity will have more impact on your HDL. For the LDL, the bad cholesterol, it's more a question of volume, the amount of exercise that you are doing to have an impact on your bad cholesterol, etc.
Okay, thank you. How does a pulmonary function test relate to your recommendation to get a cardiovascular test?
How does a pulmonary function test compare? Pulmonary function test will just look at your lung. So I mean, I'm assuming that this question is in relation to doing a spirometry test when you're at the hospital. This just measures your lung capacity. Versus a cardiorespiratory test or cardiovascular test, you're doing exercise, so it's looking at the ability of your body to circulate oxygen, so the respiratory and the circulatory system, not just the lung function. Okay, pulmonary function test will just tell you if your lungs are healthy or not. Doesn't look at the cardiac and the muscle aspect.
Okay, thanks for that clarification. How good is a Fitbit wrist device in measuring one's VO2 max number?
That's
I see you
interesting
laughing at that one.
No, it gives you a good indication. Okay, sometimes so you've got Fitbit, Garmin, Polar, you got all the watches that gives cardiorespiratory, like they'll predict your VO2 max. Once in a while, we do have a participant that comes in the lab say, oh, my Fitbit say I have a VO2 max of 45, or my Garmin says I have a VO2 max of 45, and then we do the test and they're at 37, and they're kind of a little bit frustrated. So on average, if you take 100 people and you look at their predicted value, and you take 100 people and you test them, you'll probably come to about the same number, same average number. But it will vary a little bit. But it gives you a good indication. It gives you a good indication. Yeah.
That's encouraging to know.
Yeah.
Do you
And
consider
if you have the opportunity to, if you have a watch like that and you have the opportunity to have a real test done and you see it comes really close, then it will be helpful afterward. You see, like, even if your watch was a little bit off on the prediction, then you'll see over time, like if there was a 20% difference, but eventually if you see on your watch that it's improving by 20%, it means that your number is also improving. So it gives you an indication.
Okay. Do you consider Qigong a good exercise for cardiorespiratory health?
So Qigong is what exactly? What type of exercise is that?
Uh, Hopefully that person will chime in. Um,
Glenn, are you
um,
familiar with that? I've
I'm
heard
not
it, but
personally familiar with
yeah,
it. Maybe Glenn, is Glenn familiar with it or?
No, I'm not.
yeah.
Okay.
I think I'm not sure, but I think it's more like Tai Chi or this type of exercise. Like
Yeah, it's something similar to that.
yeah,
My guess is it will be a slower movement rather than a rapid,
Yeah.
forceful
Okay.
one.
to
Yeah.
improve the cardiorespiratory fitness, usually not enough. To have an impact on health and like physical activity, some studies suggest that probably it will have an impact. But to increase the cardiorespiratory fitness, I think you need a little bit more than that. So
Okay.
I would put that in the kind of foundation category of exercise, etc. And you could put it also like a little bit of resistance training. But to improve cardiorespiratory fitness, you need to stress the body a little bit more with aerobic endurance exercise.
Are some exercises more effective against various diseases? For example, HIT training versus cancer.
So the high intensity, or what they call HIT, high intensity interval training, the name is kind of new over the last few years, but we've been doing that for years, interval training. We've seen that in athletes, etc. So it's not necessarily something new. The only issue I have with the HIT training, how they call it, and how it's publicized on the internet and everything, or even some research. When we do research, we have to compare two protocol. So we'll compare like 10 times 1 minute versus 4 times 4 minutes. So it doesn't really tell you which one is better. And actually, for me with a client, I would never just choose. I would have a variety of different interval program, like we do in athletes. Athletes don't always do the same thing. You try to put different stress on the individual. So yes, 80% of your exercise program should be more endurance, moderate intensity exercise. But the 20% at higher intensity, like the HIT, I try to vary this a lot with individual. Different types of interval training, they can be 1 minute, then they can be 2 minutes, 3 minutes. You vary them. You put different stress level on the body, not necessarily always doing the same thing. When we do research, we try to get an answer how somebody respond to a different intervention, but it doesn't mean that if one is better than the other, that's the only intervention you want to do. When you see a kinesiologist, exercise physiologist, you will vary those exercise intensities, so a lot of high intensity training, and this improves the cardiorespiratory fitness a little bit more. And this is what is helpful for the management of every chronic disease. Now it's like higher intensity interval training has been shown to be to have a significant impact on cardiorespiratory fitness and also decreasing mortality for various chronic diseases.
Thank you. Can you talk a little bit about bradycardia, specifically those with a low resting heart rate, less than 50, since their 30s and persisting into the late 60s? The concern is a drop in O2 levels while sleeping when there is no evidence of obstructive sleep apnea.
So your body will adapt. For example, let's say you're not taking any medication, etc. When your heart rate goes slower, for example, sitting at rest, on average, our cardiac output is about 5 liters per minute. This is the amount of blood flow that we need just to sustain your body for staying alive, like vital. So you need about 5 liters of blood per minute that circulates in your body. If your heart rate goes lower, that cardiac output doesn't change. It's your stroke volume. Your muscle, your heart muscle contracts propulse more blood at every contraction. So a lower heart rate means that your ventricle is more efficient and able to contract more. So when you're sleeping, because you're lying on your back or in front anyway, when you're in supine position, the heart doesn't have to beat as much because the blood flow circulates better. It's easier. You don't have to fight against gravity. So there's more blood coming into the ventricle, and when it contracts, there's more blood coming out. So your brain or there won't be any lack of oxygen, because if you have a lower heart rate, and that's why usually lower heart rate is related to a better fitness, it means that your heart is able to contract more. So it won't have an impact on your oxygen level to your brain or your different organs.
Okay. Here's a very specific question. What is the numerical conversion factor used to convert VO2 values to METs?
So it's 3.5. So for example, if you have a functional capacity of 10 METs, 10 METs multiplied by 3.5 will give you a VO2 max of 35. For us, like in the exercise physiology field, we use more milliliters of oxygen per kilogram per minute. In the medical field, they'll use more METs. So it's just a conversion. You multiply by 3.5. Or if you have a VO2 max of 35, you divide by 3.5, it will give you 10 METs. So 1 MET at rest, everybody so we have over 100 people. If you're all sitting down, we consume about 3.5 milliliters of oxygen per minute per kilogram of body weight. So somebody that's heavier is actually consuming a little bit more oxygen.
Okay. Now, this is from someone who's interested in the higher end of the cardio spectrum, specifically the risks and vascular damage associated with HIIT training, endurance training in those 60 plus.
Yeah, there's a lot of debates about higher intensity training, older individual, in even athletes. Some earlier study came out that high intensity training in older individual, you were increasing your risk of cardiovascular disease or complication. There's many other studies that came out after that showing exactly the opposite. The data from some of the studies I've shown, the higher fitness level, also suggests the opposite. Probably the only place where there's still a debate is that individual who are highly fit, who does a lot of high intensity training or does competition like running marathons, triathlons, and things like that, there seems to be potentially a higher risk of atrial fibrillation. But still, those individuals are at a lower risk of having complication due to atrial fibrillation compared to somebody who has atrial fibrillation who is not fit. So there's still that debate. But the nicely done studies looking at high intensity training in older individual are not really conclusive, saying that you're at higher risk.
All right. Now, the questions have been coming in pretty quickly and fast in the last couple of minutes, but we really have time for just one more. But if people would like to forward their questions to us at the Ottawa branch, we will then forward them to Dr. Boulay and Dr. Kenny for their response. So we'll have one more. What about for someone who is inactive but has a high metabolic rate? Does this increase the cardiopulmonary level?
If they do exercise, if somebody, can you repeat the question?
Yeah. What about for someone who is inactive but has a high metabolic rate? Does this increase the cardiopulmonary level?
No, not necessarily. You still knew. So you do have individuals that have a higher metabolic rate than compared to the general population. it doesn't mean that you're going to have a greater cardiorespiratory fitness. You still need to do that exercise. And so there were some studies talking about the metabolically fit individual or obese metabolically fit individual, etc. So that maybe have less risk of cardiometabolic condition, but it will not improve your cardiorespiratory fitness. Okay, you still need to do a lot of exercise, etc.
All right, on that note, I'd like to thank everyone for their participation today, and particularly Dr. Boulay for this informative presentation. And we'd like to express our thanks to Dr. Kenny for once again helping us organize today's session. Remember to look for our follow-up email, which will include information on how to access the recording of today's session, as well as contact information for our presenters. Remember, too, that you can invite non-members to attend our webinars and try us out as a guest. To register for upcoming webinars, please visit the Ottawa branch website. We will make sure to include our website address in the follow-up email. Thank you for everyone, and see you at our next webinar, which is tomorrow at the same time, featuring Meg Stickle-Croker of AIM Fitness and physiotherapist Alan Hicks. Thank you.
Thank you.